Morning to you all. My name is Hakan Yazıcıoğlu. I recently joined ESCAP, especially 1 month ago, as an associate statistician. Before, I worked at the Turkish Statistical Institution as an expert for 17 years on mainly the environmental statistics, environmental accounts, SDGs, and disaster-related statistics. Now it's a pleasure to meet you today. Because of some administrative issues, I am working remote working nowadays, but I will join the team as soon as possible in Bangkok, and hope to see you all in the next expert forum and also the technical working groups of this disaster related statistics. Thank you very much.
Thank you, Hakan, and we will also hear more from Hakan in terms of his reflections on this human impact statistics later from Turkey. Right. So, Aruna, with your permission, should I start introducing the table so that we can? I think my part will be very light because I think the rich discussion will be with Sri Lanka and Hakan speaking from Turkey. So I'm going to share my screen. So I hope everyone see my screen now. So we over the past 2 months we have been working with Sri Lanka, and Hakan kindly agreed to review the tables from Turkey's perspective. We are talking about one of the most important aspects of disaster data on human impact statistics. We're talking about table C2, that we can disaggregate human impact statistics by type of hazard and geographical region, and table C3 with the same information but disaggregated by group of impacted a group of subpopulations by age group or sex, urban or rural division, and other specific vulnerability groups. If we look at key aspect of information required in this area of statistics, as everyone also see on the screen, is really key part of the SDG indicators, also key parts of the Sendai indicators, and of our country reporting to the Sendai monitor in terms of number of deaths, missing, and affected population. So this table trying to provide more information in terms of whether or not we could organize the information by different types of hazards that happen, and by different level of administrative divisions in the country. Is very common in many countries that this information are organized and recorded in so-called disaster database. In some countries, you use Deciventa, that has been supported by UNDP and UNDR. Some develop their own disaster database to tailor to the needs of the country. And key information points in those databases is precisely how many people have been impacted by different kinds of disaster, either by the death or missing, injured, ill, people displaced, or if they have lost their jobs or the number of days that they didn't go to work because of the disaster events. In terms of evacuations and efforts that has been put in place and maybe recorded in those databases. And that's a big category called otherwise affected. So anything else that is not listed above is more common to have this data at an event level usually, the idea is that we should link this information with specific events that occurs, so that we can keep track of what events that actually create more human impact or less, and where exactly they create more human impact of which kind. This information will be helpful in the future planning for the rescue and response. So this is in terms of the types of disaster and administrative divisions of the country. Is also important to understand in terms of who exactly being impacted by the disaster by looking at different age group. Maybe I can rotate my view. Right, by different age group that we know that different age impacts are impacted by disaster quite differently. Gender has a role in human impact statistics. Not that disaster shows impact men more than women or women more than men, but because their socioeconomic responsibilities in different countries that put them in different vulnerable positions, depending on which context we are talking about. So gender disaggregated information is also very important. It's also important to see if this impact occurs in either in urban area or rural area, which has maybe different level of kind of need in terms of response and evacuation, depends on the kind of impact that we see. One very tragic example is the case of the earthquake in Turkey, that we have building collapse that created a lot of death, and that might be quite different if it happened in a remote area where buildings are not fully populated, for example. But that's what we want to understand also by urban and rural section. Also different specific group of let's say population of priorities in different countries, either disabled people or people who live under poverty. So that would also help us in terms of understanding what kind of, in the future, if this ever happens, we can properly employ the rescue effort to meet the need of people who are actually impacted. So this is briefly the two tables that Sri Lanka and Hakan on behalf of Turkey has been looking at. Now we're going to perhaps hear from both of them in terms of what they found. There would be a lot of definitional, methodological, statistical issues surrounding reporting and recording of this information, and very much depends on the setup institutionally and also within the statistical system, what kind of information you could or you could not do, and different kind of challenges that you may face. So with that, I will stop sharing my screen. Thank you, Aruna.
Thank you, Tirapong, for the introduction. So now I would like, before starting the session, I would like to express my appreciation on behalf of our TWG members for welcoming the proposal to present the tables. Mr. Ranjit from Sri Lanka, and then also Mr. Hakan from representing Turkey. And then now I would like to ask Tirapong again to moderate the presentation session. If I correct,
according to the agenda. Happy to do so.
Yeah, thank you.
It would be my role is very simple. So we have two presentations, one from Sri Lanka, another one from Turkey, and as you will hear, they're working with quite different setup in terms of what data are available and how data are collected and organized. So I think we will be delighted to hear more direct country experience from both of them. So with that, we can start with Sri Lanka. So Ranjit, over to you.
Thank you very much, Mr. Okay, thank you. Let me to off the camera. Okay. With the good evening and welcome all. At the very beginning, I would like to extend my sincere gratitude to the members of the ESCAP for giving Sri Lanka to this opportunity to review the disaster-related statistics. Disaster-related statistic framework summary table C2 and C3 about human impacts based on hazard type and the geographic region. Before discussing the summary table, I would like to briefly explain the history of Sri Lanka's disaster management process. Before the 2004 tsunami tragedy, we did not have the specific institution or methodology for handling disaster management process. Still, we had relief and compensation methods to support the victims under the Department of the Social Services. The overall impact of tsunami 2004 is reported as 27,589 people deaths, 889,175 people displaced, and 79,000 houses destroyed. By the then prevailed government established a disaster management institution to coordinate that disaster management process. Actually, in addition, the government introduced a Disaster Management Act. Under this act, the enable the establishment of several institutions for the convenience of the disaster management process. Firstly, they established the National Disaster Management Council, NDMC, chaired by His Excellency the President, Vice Chair by the Prime Minister, participants from the opposition, participants from the minority community, and the chief ministers of the 9 provinces. In this high-level oversight committee provides directions to countries' disaster risk management process. Secondly, they established Disaster Management Center, DMC. It was established to implement the functions indicated in the Act, coordinate with the relevant stakeholders. And thirdly, they established National Disaster Relief Service Center, NDMC. NDRSC provides all reliefs and compensation for the affected people and implement post-disaster recovery and rehabilitation programs. Furthermore, they prepared a disaster management policy to act as the main governing mechanism for disaster management. In 2010, they prepared the National Disaster Management Plan, NDMP, 2013. They prepared the Sri Lankan Comprehensive Disaster Management Program, 2014. Next slide, please. Next slide, please. Next slide, please. In addition to those institutions, the Department of Census and Statistics collects population, demographic, and socio-economic data, which are used as baseline in disaster situations. The Disaster Management Center also maintains the disaster information systems called DISINENTRA and the Disaster Resource Network, SLDRN, and risk information databases. Also, have been This database facilities have been provided to obtain the data contained in these databases free of charge to the relevant parties and stakeholders. Now let's see how to get the data to fill DRSF table C2 and the C3. Actually, we hope to collect data for DRSF tables by using three methods. First one is administrative records from the existing data collection mechanism. Second one is census and services. Third one is metadata. Actually, next slide, please. Next slide, please, Mr. Next slide. Next slide, please. Go to next slide.
Hi, Ranjit. I think there's a
Are you
slide
hear
I'm
me?
pressing. So which slide are you perhaps referring to that you might want to speak next?
Please, next slide.
This one?
No, another one.
Next
Forward.
one.
Yeah.
Forward.
Yeah.
Can you go to the next?
Right. Okay. Okay. That's okay. Right. The one is we collect the data for DRSF table C2 and C3 using administrative records from existing data collection system. Actually, the disaster management division and the Department of Census and Statistics are exploring the possibility of completing the disaster related data system using administrative data from the NDRSC and Disaster Management Center DMC and the NBRO National Building Research Organization and the other relevant agencies. In addition to that, the disaster management is maintain the risk info geospatial database for collecting disaster data. The problem we have to face here that the only few districts of Sri Lanka are covered by the risk information data. And NBR also do with their technical contributions, they have development and updated the data system containing the socio-economic data of landslide prone areas. But NBR also don't have cover all landslide prone areas in getting disaster related information, but it is an ongoing process. And within the next 5 years, they will be able to cover the entire prone areas. Please, next slide. Go one slide forward. Right. And this is actually no before one. Yes. Yeah. Now now you can see the Tirapong before this slide.
So Ranjit, are you referring to the slide that
Yes.
say data for the DRSF table to C2 and C3 on administrative records?
Yeah, but no, this before that we want to slide. You want to see the slide available data sources for DR?
Oh, okay. It's this one.
Yeah. Yes, yes. Okay. Now we see the available data sources for DRR. For understanding the disaster risk, risk profile was carried out with the technical support from the concerned agencies, technical institutions, and academia, the prioritizing of 5 hazards: floods, droughts, landslides, cyclones, and coastal hazards. Now you can see the left side, the institutions, and the right side available data types. Disaster Management Center, we can collect data from death, missing, affected people, loss and damage, data, etc. The National Building Research Organization, NBRO, we can collect the landslide hazard related data. The Department of Irrigation, they collect flood hazard related data. Agriculture Department, University of Peradeniya, and Department of Meteorology, they collect drought, cyclone hazards related data. The Coast Conservation and the Coastal Resource Management Department, they collect coastal hazard and related data. The National Disaster Relief Service Center in DRSC, they also collect death, missing, affected, and loss and damage data for compensations. Please, next slide now. Right. We discussed earlier and go forward one. Right, okay. The administrative data we discuss always. Now, yes, now okay. Now you can see the example of the disaster NDRSC data set. They already collect the district and number of divisional secretariat divisions, the affected families and the people, number of death and injured population and the missing population, house damage, full house damage and the partially damaged houses. Likewise, you can see a lot of data in this format. Now we use actually, we can use this database for to fill our C2 and C3 databases. Go next one. Next slide, please. And yes, okay.
Is this slide is the Sri Lankan map on?
Sorry?
Which slide are you referring to?
Is this the correct slide, the one we are sharing?
Yeah, this slide.
Okay, okay, please continue. Thank you.
Yes, yes. Yeah, now in addition to DMC, NDRSC, and NBRO data sources, we can collect data by using census and surveys. Actually, Department of Census and Statistics, DCS, collects a lot of disaster-related data by using a population census and population census, and we mostly collected by data using GNI census. The GNI census mean Grama Niladhari information. This Grama Niladhari information collect by get the information in lowest administrative levels. So now you can see the left side, some questions we put into that questionnaire. What are the hazard types, and the right side you can see the questionnaire we input for the 2023 main census to collect regarding the disaster related statistics, and the down map you can see the analysis of the GNI data, and we can identify what are the landslide area and what are how it is distributed within the districts. And the three other one is we can a lot of government and non-government institutions are collected data for collecting disaster data for their purposes, administrative purposes, and it is include disaster related data. So we hope to use these metadata to help gather to make our C2 and C3 table, prepare our C2 and C3 tables. Next slide, please. Yes, okay. Now let's see the summary table of human impacts by hazard type and geographic regions. Now you can see actually the first one is geo-region. We can get the geo-region wise data by using NDRSC and disaster management center data. But the thing is, the some data of the NDRSC, there is a threshold level gap in between the disaster management center and the NDRSC center, because disaster management center collect by DS division level, National Disaster Relief Service Center collects data by Gramanildari or GN division levels, so that we cannot compare these two databases together for error checking likewise. But we have correct, we can get the NDRSC data for fill this table by geo-region. Another one is by geographic type of hazards. In this column we can use all disaster have categorized in general terms, but we have a problem with the we don't have the separate definitions and threshold levels, but we can fill this data by using NDRSC and disaster management database, because disaster management database is collect the smallest administrative units in Sri Lanka and also identify the most specific disaster related to the area, and the NDRSC data also shows 95% accuracy in relation to the DMC and NDRSC data, because when the data comes to the national level, it is recommended by the Gramanildari, divisional secretary and the district secretary, and approved by the district secretary, and it's sent to the Ministry of Disaster Management, so that that data verified by 3 levels, and that data is we think 95% accuracy than other databases, so that we can use this data for filling this columns. And another one is death and missing. Death and missing data can collect also by using NDRSC administrative data. This data also most reliable, accurate, and verified by the 3 levels, so that we can use this data for filling death and missing columns. But the problem is they do not collect the disaggregation level data by sex and by age group. But these days we are discussing with them to edit their questionnaire for input the by sex and age level type data collection question into that questionnaire. And another one is injured and illness. Actually, we cannot count correctly these figures because people take some affected people take medicine from various hospitals and the various medical centers, so that the officials who handle this situation, they cannot collect the real number who get the medicine from the hospital, so other places, so that it is difficult, but some level we can collect this data by using NDRSC and Disaster Management Center databases. Next slide, please. Yeah, and displaced population can accurately collect from NDRSC and NBRO, National Building Research Organization database. This data also verified by the Gram Niladhari level, Divisional Secretariat level, and the District Secretary level. Disaggregation data can also collect some certain level, but this also 95% accurate this accuracy data. But the another one is dwelling damages. This data can collect accurately from the NDRSC and National Building Research Organization database, data verified by the GN, DS and the district level. Disaggregation level data can also collect some certain level, but the thing is because this when we before giving the compensation for loss and damages and death and missings, we get the death certificate, the official registered death certificate, and the certification of the Gram Niladhari from and it's certified by the divisional secretary. It is true or false, so that the NDRSC database is very accurate than the other database, so that we can use that database for fill these tables. For other one is number 1.5, jobs and occupation losses. Actually, we don't have mechanism is yet to be established to this collect this data. In future, we hope to make mechanism for collect this data. Next slide, please. Right. The evacuated. The evacuated data can collect accurately from the NDRSC and NBRO data. This data also verified by the Gram Niladhari, Divisional Secretary and the District Secretary. Right. Yes, okay. Number of people evacuated of received aid. This data can also collect approximately from the NDRS database. However, private sector evacuation are not being counted due to lack of proper data gathering mechanism for this field, so that it is difficult to collect the accurate number, but more than 75%, 80% we can collect this data. We want to improve our data collection mechanism to develop this sector. And otherwise affected another section. This area has not been addressed yet, actually. Another slide, please. Next slide. Next slide, please.
We are at table C3. Ranjit, can you see the same?
No, next one. I think sometimes I don't heard you. Hear you.
We are at
Right.
table C3.
Yes. Okay. Okay.
Okay.
Now this here. The age groups, by age groups, the by age group data can correctly get from the NDRSC database. By in this period, they do not collect by this age group wise data, but now we are discussing with them how to input these columns to their questionnaire for collecting the age-wise group, and they agreed with us to input these columns for their questionnaire to collect this data. And another one is male and female, by sex, male and female. This data can collect also the NDRSC database. This data also verified by the Gramanildari divisional secretary and the district secretary. They also agreed with us, NDRSC officers, input this column also to their questionnaire to collect male by male and female data. Next slide. Urban and rural slide. Next one. Yes, okay, right, okay. Actually, another one is C3A, urban and rural population. Interaction with the Department of Census and Statistics, already we have the database by sector, and we can interact with this data with the NDRSC data. We can get the by urban and rural. In addition to that, Census Department collect the other sector by state. Furthermore, we can get even by urban, rural, and estate sector, so that we want to actually we can get that data easily, integrating with the NDRS data and the DCS data. And the last column is specific vulnerability groups. At present, we not exact system has been set up, but it is hoped that system will be set up in future. We don't have now. We do not use by disabled or poor. Next slide, please. Yes. Is now let's see the challenges. Actually, we have different agencies, different definitions, and the different formats. Lack of practical trainings, lack of knowledge among institutions regarding the DRSF, lack of national data sharing policy between institutions, absence of the single strong database for DRS. Those are the challenges we are currently faced. Actually, next one. Yes. Thank you very much for hearing.
Thank you very much, Ranjit. I think everyone would think like me that this is a very good review exercise that you have undertaken. And as one takeaway point that I can see from Sri Lanka, before I open up for any questions that participants may have, the Sri Lanka really relies heavily on that GN kind of engagement at a grassroots level in terms of data collection, data verification, and working with the NDR SC very closely. I think that is a unique advantage in Sri Lanka, that you have this system in place, that you could accurately collecting the data, verify the data, and put that into the national database. Of course, there are a lot of challenges, right? And a lot of you mentioned is really the topic of priority for the TWG. How do we have a coherent classification, the definitions? How do we make sure that different databases connect and linked to make sure that we have a consistent set of information for this, at least human impact statistics. So I would like to open for any questions that any of the participants may have. All right. If not at this point, may I invite Hakan to make his presentation first, and we may come back to the Q&A later. Over to you, Hakan.
Okay. Hello again. Now I will share my screen. Can you see the screen? Okay. As I said, I just joined ESCAP, and today I would like to make a presentation on the possible review of the DRSF tables C2 and C3 for Türkiye, as I engaged in the work of this related statistics at Turkish Statistical Institute. As you all know, two devastating earthquakes struck Türkiye in February this year, and it killed over 50,000 people and caused many buildings to collapse and affect more than 30 million people in 10 cities. So here in Turkey, all the institutions, including the AFAD, which is the Disaster and Emergency Management Authority in Turkey, and the ministries, municipalities, and non-governmental organizations are now on the ground for to meet the post-disaster needs and maintain the recovery. Thus, I was actually unable to collaborate with the colleagues in AFAD in preparing this presentation, which also can be considered as a challenge during a disaster time. So I would like to express that all the information I will provide today depends on my expertise and experience with the disaster-related statistics, as well as an online search conducted by me. Now we can move on the content of my presentation. Today I would like to start by giving a brief information on the institutional arrangement and national disaster management in Turkey, which I believe would facilitate to understand the current status and responsible institutions taking action during a disaster response. And then I will try to map this information with this related statistics framework tables, which will reveal the possible production of the this related statistics in the context of table C2 and C3. And next, I will introduce the disaster management and decision support system, which is called IDES, and address-based population registration system of Turkey. These are the key data sources to produce also to complement to produce the district-related statistics. And after that, I will give some information on the death certificates and the civil registration and vital statistics of Turkey, and finally mention about some challenges in filling these DRSF tables. AFAD is the Disaster and Emergency Management Authority in Turkey, and it is established in 2009. It aims to prevent the disasters and minimize the disaster-related damage. It plans and coordinates the post-disaster response and promotes the cooperation among various government agencies. Up to now, AFAD prepared disaster risk reduction plans, disaster response plans, and disaster recovery plans for Turkey, and also identified some action plans in the context of these plans. Today, I will put more emphasis on the disaster response plan of Turkey, which is called as TAMP. TAMP defines the roles and responsibilities of the working groups and coordination units that will take part in the disaster and emergency response studies, and it determines the basic principles of response plan before, during, and after the disaster situations. It includes ministries, institutions, and organizations, the private sector, non-government organizations, and real persons who will take part in responding to disasters and emergence of any type and any scale that may occur in Turkey. After introducing the TAMP, I would like to mention about the IDES, which is the web-based application built on geographical information systems. It effectively manages all the resources in disaster and emergency situations, and it has decision support mechanism inside. All the institutions specified under TAMP use this system to conduct their activity and enter data through the specific models assigned them, like health module, damage assessment module, or search and rescue models. So here we can say that IDES is can be considered as the main data source for the disaster-related statistics, and also for filling our DRSF tables for Turkey. In the next two slides, you will see the institutions and their responsibility during and after a disaster under TAMP. As you can see from the table, I have linked the activities of the responsible institutions with the possible disaster-related statistics of the DRSF to be produced, and colored the associated lines to make it visible for you. For example, in the first line, we see AFAD it is responsible for disaster information management, assessment and monitoring, and also search and rescue activities and sheltering activities. It coordinates the emergency and temporary sheltering services of disaster victims. So the number of displayed persons statistics at the DRSF tables C1 and C2, I believe, can be produced from this sheltering activity of AFAD, because AFAD enters these data in IDES, so these data can be can be extracted and converted into our district-related statistics. Also, in the second line, Minister of Family and Social Services is responsible for the psychological support and the coordination of collection, warehouse management, and distribution of in-kind donations made to the disaster victims. So, in terms of the human impact, the number of people receiving aid, these statistics can be also computed from the records of the ministry entered in IDES. And the third ministry is the Environment, Urbanization and Climate Change. It has many activities, but two of them are related with our subject. The ministry promptly determines the approximate extent of preliminary damage to infrastructure, for example, water, sewage systems, treatment systems, and also it damage to building stock in the disaster area, and also coordinates the damage assessment services. So I think we can produce the number of people whose houses were damaged or the dwellings damaged, statistics from these activities of the ministry in IDES. And also it is responsible for the coordination of the identification of the deaths and the burials. So we can also gather data for number of deaths from these records of the ministry in IDES system. The other record of the Minister of Interior is the evacuation and resettlement. The Minister of Interior and accordingly AFAD is responsible for the planning, implementation and coordination of the evacuation to be made before, during or after the disaster. So the statistics for the number of people evacuated can be produced from these records. Also, the Ministry similarly, the Minister of Health is responsible for the health services, that means the needs of first medical intervention, public health and medical cares. So from the records of the Minister of Health, the number of deaths, number of injured or ill can be easily extracted. And lastly, we see the Turkish Red Crescent responsible for the nutrition services. This will also enable us to produce the statistics for number of people receiving aid in the tables of DRSF. So I mentioned about the possible production of disaster-related statistics at table C2 and C3, especially of DRSF. These statistics mainly can be produced from the IDES system. But also there's an important administrative register that allowed Türkiye to produce actual information on population size of localities and characteristics of the population. This system is called the address-based population registration system. All the people living in the country are covered in their usual residence and recorded with their unique Turkish identity number in the system. So the addresses and the identities and the personal informations of the people are matched and recorded in the system. This system enables to provide information on the population by localities, by province, districts, villages, etc., and by age and sex by integration, migrations, legal marital status, place of registration, educational status, and nationality of the persons living in Türkiye. Therefore, if there is a missing data in IDES, it can be complemented by data integration of these two systems, IDES and IDES-based population registration system, with the common key variable, the identity number of the Turkish people. The other system that I want to mention today is the well-functioning system of registration of deaths in Turkey. So the mortality statistics are derived from the administrative records from the civil registration systems, which record all the deaths and causes of the deaths in the country. As it is seen in this slide, Turkey uses the international death certificates, which is known as Formula C, to record the deaths. This certificates provides information on the identity, nationality, birth date, so the age, sex, educational status, occupation, residence, address of the disease, type of death, and cause of death. And it is issued in 3 copies for the certificate of inheritance, for burial purposes, and for the statistical purposes. So in our context, it can be said that if the statistics on a number of deaths from a disaster can't be complied, or there is a missing data or a disaggregation in the statistics, the death certificates or the civil registration systems can be used as a complementary data source. But it should be noted that the cases of deaths resulting from disasters should be incorporated correctly and completely into the civil registration system and aggregated mortality statistics of the country. This is important for the complete records of this statistics. And also another challenge here is the limited number of international classification of diseases codes, which is known as the ICD codes. They don't cover all the types of disasters and this can cause a problem. Also, the correct diagnosis of the doctors or the medical personnel to attribute disasters, to attribute deaths to disasters is important. This requires training of these medical personnel also in terms of disasters and death causes. Now, lastly, I want to mention about the challenge in filling these DRSF tables. As I presented in the previous slides, many institutions are involved in the disaster management activities, which makes coordination and collaboration difficult. Also, it causes scattering of data among different institutions, which can lead the problem of misunderstanding and misuse of common definitions, concepts, and terminology. This is a problem among the institutions to produce the compatible statistics. Also, when a country experiences a catastrophic disasters, it is hard to identify deaths or missing people because it can result in large number of deaths or injuries due to this catastrophic disaster, and it can also cause extensive damage and destruction of properties or facilities. Also, it can produce an overwhelming demand on state and local response resources and mechanisms. So it will be hard to identify the deaths or missing people during this catastrophic disaster. Also, it maybe some of the dead bodies will not be picked up from the rubble, or it will be difficult to determine the correct number of deaths or missing or the injured people due to the size of the disaster. These are the challenges when the catastrophic disasters happens in a country. Especially Turkey has also experienced such a situation nowadays, and I wanted to mention this possibility in this review. Also, the table C2 and C3 asks the number of major and minor injuries as a disaggregation of injured people, which is hard to determine, I think, because the records of the injured people from a disaster is kept at hospitals or other health units in Turkey. So these records may be investigated and recoded as a major or a minor injury by possibly looking at their ICD codes. But this is actually time consuming and hard to distinguish and identify. So this disaggregation, I think, can't be filled in these tables. Another challenge specific to Turkey is the urban-rural disaggregation in table C3. The urban-rural definition in Turkey depends on administrative boundaries. Until 2014, Turkish Statistical Institute took into account the classification that defines settlements with 20,000 or more population as urban, and the settlements with 20,000 and less population as rural, using the criteria of the city threshold survey published by the State Planning Organization of Turkey. So according to this classification, 72% of Turkey's population lives in cities, the urban areas, and 28% of the population lives in rural areas. The effects of the administrative division change that took place as March of 2014 on the rural urban structure were very important in this case, because with the change made in accordance with the relevant laws, 14% of Turkey's rural population has become the urban population, while 86% of the population has become the urban population. So, for example, for 30 provinces that gained metropolitan municipality status in Turkey, the villages within the provincial boundaries gained neighborhood status. And the rural ratio in the rural-urban definition based on the population limit of 20,000 decreased from 21% to 3% in these metropolitan cities. For this reason, since 2014, Turkish Statistical Institute hasn't produced any statistics in urban-rural level, and it was decided to produce it throughout the country. So the urban-rural data in accordance with the definition of European degree of urbanization, which is known as Degurba in province, district, and grid level, will be produced by the Turkish Statistical Institutes. After this identification, the locations can be attributed as urban or rural. Now it's hard to define the places as urban or rural in Turkey in the statistical context. Another challenge is the definition of disability, because disability is defined in the International Classification of Functioning Disability and Health, which focuses on limitations in functions rather than medical approach, such as organ loss or dysfunctions. For example, difficulty in seeing, hearing, speaking, learning, remembering, performing simple for operations, and mobility difficulties in walking, carrying, holding, or going up and down stairs are examples of disability. This kind of disability can be estimated only by conducting surveys, since the administrative registers for disabled are based on the medical approach, the organ losses or dysfunctions, and the disability. This disability is determined by a degree out of 100% with health reports. So, therefore, if Turkey disaggregates this related statistics in terms of disability, it will report the number of disabled persons by using administrative registers as a complementary data source, which will not be compatible with international classification, I think. Lastly, the definition of poor also, or the defining the poor can be a challenge while producing the disaggregated related statistics. As you know, according to World Bank's measure of poverty, which is linked to $2.15 a day, which means population living on less than this amount a day with the 2017 purchasing power parity, is considered as poor. Due to this definition, nearly zero population can be considered as poor in Turkey. But we have also our national poverty lines. If we consider the issue in terms of national definitions, according to the general level of society, the individual or household whose income or expenditure below a certain limit is considered to be poor in relative terms. Thus, the people who fall below the limit, which is the 50% or 60% of the equalized household disposable median income, is defined as the poor or the population at risk of poverty. Based on this definition, 15 to 21% of the population in Turkey can be considered as population at risk of poverty. So the relative income level is very important while defining a person as poor or not. So the poor disaggregation of this disaggregated related statistics is, I think, a bit hard to determine, since the income level will be used by whom is unclear. Remember, there are various institutions recording these disaster-related data in the IDES system, and how they evaluate this situation can be rather complex. So some of the institutions may accept the declaration of the people that they are poor or not. So this definition should be cleared before entering all these data in the IDES system. Thank you for your attention and listening to me today. Thank you very much.
Thank you very much, Hakan. And I understand how challenges it would be in this time in coordinated with the digital agency. But listening through what you have gathered so far, I think this is excellent. Thank you very much. I have one question. My understanding is that a lot of data are being aggregated through the IDES system. Can you say a few words about data verification before data enter the system?
As far as I know, the institutions operating in the field are collecting their own data in terms of their activities, and I think they use some forms or some tablets to issue or enter these data in the system. Also, they check these data with the possible sources. For example, number of dates data is compared with the data in the municipality funeral systems, because the people, the deaths are buried, and they are also recorded in the municipality system in the cemeteries, and also these in religious terms, these data are kept in our another institution which is responsible for religious activities in Turkey. So these data, the Minister of Health data, the data in the cemetery system, and the religious authorities data are all compared in terms of defining the number of deaths correctly. I know this, but I don't know much about all the details in the activities of these institutions. And as I mentioned before, I couldn't actually cooperate with our colleagues in AFAD to clarify some points up to now. Thank you.
Yeah, no problem. Thanks a lot, Hakan. So this is very helpful. I saw a hand from Eileen, our former colleague. You have a question?
Yes. Thank you, Por, and happy to join everyone again. So let me just go back to that slide showing vulnerable groups. I think if Por can help us look at that slide.
Hakan, could you share your screen again? So that's for Turkey, right?
You mean for
Sorry?
Turkey?
Yeah, for Turkey. The one where
Okay.
you're showing the vulnerable groups on poverty line.
You mean this slide?
Yes, yeah, that slide.
Okay.
Here I see there may be, I mean, because defining the poor in terms of the international poverty line and the national poverty line, I think one way, I don't know if the group would agree, or this is just a suggestion to avoid confusion, because there would always be different numbers if you do it in both ways. So in this case, it may merit to actually break this column further. So poor A and B as defined in the international poverty line and as defined in the national poverty line. That is just one of the comment I have. Whether you use the national poverty line for your internal purpose for your government, and then you maintain the international poverty line to have that comparability if you intend to compare it across country. So that's just one point that I want to raise in terms of this particular column where you have this hard to define group and which income level. Thank you.
Thanks, Eileen. Right, and if we look at challenges from Sri Lanka and Turkey, I think one common challenge is again coming back to the issues surrounding the use of common definitions, classification, methodologies in data collection, and I think this speaks a lot to the work of the TWG. So in that sense, I really appreciate the reviews from Ranjit and Hakan that actually give us this emphasis again, that I think this is the area of work that we really need to advance. So we have around 10 minutes left, so open the room for any other questions.
Just to add a little bit more, Pong. So on my earlier comment, it's basically when there is conflict between country definition and international definition, one way to actually taper the effect of confusion is to have a separate column for them within the same column that you're referring
Right.
to.
So we represent
So
both.
maybe the group can think about this going for this kind of approach, because the national poverty line will always have an internal purpose to the country. Think, for example, just an example, but so is every other term. Thank you.
Thank you very much. So we're still open for any questions that any participants may have. Right. So if not, so this PowerPoint will be uploaded to the website of the TWG. So for everyone, if you would like to revisit the presentation, so you can do so. And so this is our third episode of the DRSF table review. We are gathering this knowledge and practices that, and towards the end we would summarize them into hopefully useful addition into the DRSF manual. And the next round, for the first edition, would focus on material impacts from disasters and disruption to key basic services. And again, as our practice, we're going to work with two volunteers. I'm wondering if any country would like to raise their hand now. So let me give a sample, the gist of the next episode. So we're talking about how to how to actually measure and maybe value the impacts that in terms of the house destroyed, how much that is cost, the length of road that has been damaged. So those are again very important information for disaster management and planning. So I pause for 1 minute in case I see any country would like to raise their hand for the next episode of the DRSF table review. So I will certainly contact our colleagues here, and at some point I'm sure everyone maybe they want to think a bit on what is involved. But as I mentioned all the time, we're going to work with two countries over the next 2 months, and the time requirement is very minimal. It's basically mostly maximum 2 times that we talk virtually, and you maybe consult internally within your country on what's possible, what not possible, what are the challenges. And I hope through the past 6 countries that we have been working with, I think the reflection has been that it's beneficial to that country when they join this exercise. So I think that might be something you might want to consider for the 4th episode. Right, so I have towards the end, maybe I have one announcement, which is actually very important and very much relevant to our group. I'll hand it over to Rike.
Okay. Yeah, thanks. Thanks, Tirupang, and thanks also to Ranjit and Hakan for the excellent presentations. I really think that getting into this level of detail in the review of the tables of the DRSF is something that all of us learn a lot from. And so that it's a very good way of getting past these more broad and general conversations about disaster-related statistics. It really gets us into the in and out. So the announcement that I've been invited here to make relates to an upcoming forum for users and producers of disaster-related statistics. Many of you will already be aware, but I think it is a very good opportunity to make sure that everyone on this call and in the TWG are aware of this. We will be organizing an expert forum for producers and users of disaster-related statistics. We will organize the forum here in Bangkok using a hybrid modality. We do hope that this is an opportunity for many of us who've been working virtually together for several years to finally meet in person. So we will be catering also for in-person participants here in Bangkok. It's a global meeting, and it is a meeting that is organized together with all regional commissions of the United Nations, as well as the United Nations Office for Disaster Risk Reduction, UNDRR, as well as with the UN's headquarters, so our statistics colleagues also in New York. So it is an opportunity to learn from each other, not only within the region, which we do very much in this TWG, but also to go beyond that and listen to what's going on in other parts of the world. So it's very, very nice to see Eileen joining the meeting today. Eileen is based in Addis now, working for the UN's Regional Commission for Africa. So we really have an opportunity to globally exchange experiences with, of course, also the aim of finally managing a globally agreed framework for disaster-related statistics, so that we can really get into these details and agree on a way, for example, to classify hazards and disasters, which is something that another participant today, I see Kansa is also on the call, has been very much spearheading. We plan to organize sessions during this forum along the different elements of the disaster-related statistics framework, so that we really follow a structure where we can all link the discussions to specific aspects of the DRSF, including the tables. So hopefully this will also be a really good learning week for all of us. Now, the sessions that will be possible to participate in, also if you are not able to travel to Bangkok, will be sessions that are organized during the evening time in Thailand, so simply to cater to a global audience. We will then combine that with in-person afternoon sessions in Bangkok. And also during the week of this forum, we will continue to have related events throughout the week. So the forum per se is from Monday to Wednesday, and then we open up for related events on the Thursday and Friday. So if any of you are thinking of organizing consultations that relate to disaster statistics, I mean, this may also be an opportunity for you to organize your events in Bangkok. I should also say that at ESCAP, we are right now counting, the dollars we have in different projects to see if we can somehow fund the participation of at least some of the champions from the national statistical offices and or the national disaster management agencies in Asia Pacific. And of course, we are thinking of the TWG as well for this. But the funding is very limited. We are counting the dollars. have a look at the moment at the website. There's very little information, but it should be sufficient for you to maybe talk to a few colleagues in your agency and figuring out whether you may have a possibility of joining the forum in person or virtually. And if there is a specific wish for someone to travel to Bangkok, feel free to reach out to us here at ESCAP and we will see what we can do. But I just want to say up front that the money is tight, so don't get your hopes up too much. But you're always welcome to contact us. We are still finalizing a more elaborate concept note together with our many co-organizers, but that should very, very shortly get on the forum website. And I should also say that the person who's coordinating here is actually Hakan, who's been presenting to us all today. So I'm very happy that Hakan has joined the ESCAP Secretariat. So that was just the person we were looking for there. Okay, so back to our chair.
Thank you, Ricky, for the excellent news. And then also I would like to thank our presenters for your very informative presentation. And then thank you, Mr. Ranjit, and then thank you, Mr. Hakan, for your great presentations. And then also Ricky, hopefully I look forward to seeing our TWG members in person or online during this event. And Tirapong, I'm sorry that you have to work with the TWG members to push them to voluntarily participate in this disaster-related statistics framework tables, and then hopefully the countries, you will find the countries who can make it voluntarily within 2 months until our next meeting. So is there any administrative arrangement from UN Secretariat before I declare this meeting closed?
Nothing from our side, but yeah, the benefit is actually mutual. I learned a lot from this process too. So I think that is good, and maybe we'll see each other again in the post episode of this series.
Of course, yeah. And then if there is none, I would like to thank you again for your active participation, and then especially our presenters. And then see you soon in person or online. Thank you very much. Have a good day.
Thank you.
Thank you.
Bye.
Thank you. Bye.